Hello everybody, my name is Aiden Herger. Today I'm going to be presenting my project, The Hidden Cost of Type 2 Diabetes in America. Every morning across America, millions of people start their day thinking about blood sugar levels, insulin injections, or what they can and can't eat. For them, managing type 2 diabetes isn't just a routine, it is survival. According to the CDC, nearly 38 million Americans live with diabetes, and about 95% of those cases are type 2. That's almost 1 out of every 10 people. The number keeps climbing, and that's what's even more concerning, is that now it's affecting more young adults and even teenagers than before. So what exactly is happening inside the body, right? Type 2 diabetes develops when the body becomes resistant to insulin, and the hormone that helps move sugar from the blood into the cells for energy. When the cells stop responding to insulin, sugar builds up in the bloodstream. At first, the pancreas works over time to make more insulin, but eventually it can't keep up. The result is high blood sugar that damages the body over time. The constant high blood sugar can cause serious problems after about 3 years. It can lead to heart disease, kidney failure, nerve damage, and even blindness. Diabetes is actually the leading cause of adult blindness and non-traumatic amputations in the United States. According to the American Diabetes Association, diabetes contributes to over 100,000 deaths each year and costs the country around $327 billion annually in medical expenses and lost productivity. To understand this issue better, I spoke with my teacher of my nutrition class, soon to be a registered dietitian, who works with diabetic patients. She explained that while medications like insulin are life-saving, lifestyle changes such as eating a balanced diet and staying active are the most powerful tools for preventing and managing the disease. But those changes can be hard to make. In many communities, fresh foods are expensive or simply unavailable. The National Institute of Health reports that people who live in food deserts, area with limited access to grocery stores or fresh produce, are much more likely to develop type 2 diabetes. When I started researching this topic, honestly, what surprised me the most were the personal stories. I read about a woman from Texas named Maria who was diagnosed with type 2 diabetes in her 30s. She worked 2 jobs, raised 3 kids, she worked incredibly hard, and lived in a neighborhood where the closest grocery store was 2 miles away. But fast food was on every corner. She said that before her diagnosis, she didn't realize how much her environment affected her. After joining the local diabetes support group and getting help from a community nutrition program, she began learning how to cook healthier meals on a budget without compromising on flavor. In just a year, she lost weight, lowered her blood sugar, and even helped others in her community do the same, right? This is really important because stories like Maria's show that managing diabetes isn't just about willpower, it's about education, access, and support. According to a 2024 NIH study, community-based programs that combine medical care with education and peer support reduce diabetes complications by nearly 30%. That's a huge difference made by just helping people stay informed and connected. But that's not the only solution, right? Even with this progress, there are still major barriers. Many Americans can't afford the cost of insulin, which has tripled in price over the last 15 years. Some people ration their medication or skip doses because they can't pay for it. That's not just dangerous, it's unacceptable in a country with so many resources. Luckily, new legislation and nonprofit organizations are starting to address this issue. For example, the nonprofit T1 International has been advocating for insulin price caps and more affordable access to diabetes care across all states. While their main focus began with type 1 diabetes, their advocacy has also helped millions of people with type 2 who rely on insulin or other glucose-lowering medications. My professor, Ms. Patricia Sanchez, said, "It's not that people don't want to be healthy. Sometimes they just don't have the same access or resources." That really made me think. Type 2 diabetes isn't just a personal health issue, it's also a social and economic problem. There are organizations working to make a difference. The American Diabetes Association, or ADA, is one of the most active. They fund research, push for more affordable medications, and provide education and support for families dealing with diabetes. Their Know Your Risk campaign even offers a free online test that helps people find out if they might be pre-diabetic before symptoms appear. Another important effort is the CDC's National Diabetes Prevention Program. This program partners with local health centers and community organizations to teach participants healthy habits through group classes and long-term support. Studies show that people who take part in this program can reduce their risk of developing type 2 diabetes by up to 58%, and for older adults by as much as 71%. The National Institute of Health also continues to study the more connections between diet, physical activity, and diabetes. Their research shows that small, consistent changes like walking a half hour a day, replacing sugary drinks with water, or learning to cook balanced meals can dramatically improve blood sugar and your overall health. Type 2 diabetes affects millions of people, but it doesn't have to control their lives or our country's future. We already have the science and the resources to make a real difference, and now it's about awareness and access, which is why I'm making this video. If you or someone you know may be at risk, you should visit diabetes.org or cdc.gov/diabetes to find free tools, local programs, and helpful information. Type 2 diabetes is preventable for many, manageable for most, and worth fighting for everybody. Together we can change the story, one person at a time. Thank you.